On COVID-19 outbreaks in nursing homes, but there's another vulnerable population experiencing a surge of cases.
Study by the Chicago Tribune and ProPublica revealed more than 1 in 5 Illinoisans living in state homes for adults with disabilities have tested positive for the virus. One of the reporters who worked on this study, Jennifer Smith Richards, joins us right now. Jennifer, thank you so much for joining us today. What kind of issues are we talking about? As we said earlier, we're always talking about nursing homes, but we haven't really talked about these homes where people living with disabilities, and I know that must be tough not only for them, but for the caregivers and the families.
It really has been, and there are many fewer adults with developmental disabilities living in these state-operated centers. Illinois has 7 of them. Then there are nursing homes, but some of the challenges are really unique to these centers that are caring for individuals with developmental disabilities. In many cases, these people don't understand why their families have stopped coming to visit, why they don't get to go to their day programs where they may be doing recreational things or even working in jobs. It's difficult to isolate in a communal facility at all. So a place where there are communal spaces where you bathe and where you are eating makes it really hard to stop the spread.
What are some of the things you found that they've been trying to do to improve the situation? I know you wrote that there was an infection control team that went in there back in March, correct?
That's right. So the state has done several things. And of course, the workers in these centers who also have been affected by the virus also have been kind of doing everything they can to make sure that the routines for the individuals who live there are as normal as they can be. So they're looking for, activities and games and things to keep people occupied during the day when they may not be used to staying home, just as we are elsewhere. The infection control team did come in. The National Guard has been in a couple of the centers to come in and help with testing. So for some of the centers, there has been widespread testing that did expose, sort of the quiet and broad way that coronavirus affects people.
Yes, and I know that a lot of families are missing out in visiting their family members, but they're kind of resorting to the old traditional way of communicating, right?
Yes, there are lots of ways that people are communicating. Some of these individuals don't have cell phones and iPads, and so they're not doing necessarily FaceTime with their loved ones, although some are. But what we're seeing is people writing letters and having pen pals with the folks that they are used to coming to visit their loved ones in the centers. So we've seen lots and lots of really touching, heartfelt letters back and forth, just hoping that they can see someone that they really enjoy soon and that this will be over soon.
Have things improved, Jennifer? I mean, based on some of your numbers, we know you said that there were 1 in 5 who had tested positive. Are things getting better, or were these older numbers?
So, I think it sort of depends on the center. There are some centers where the number of cases has slowed, and that's great. So I know that one that's pretty close here to Chicago has had a large number of cases, but recently the pace has slowed. When we wrote the story that published this morning, there were 355 total cases among residents at all 7 developmental centers. Today, there are 10 new cases. So, there still are new cases being discovered as testing broadens, and as, in some centers, every staff member and every resident has been tested, and they are discovering, new positive cases.
Jennifer Smith Richards, thank you so much for being with us. Be safe, be well.
Thank you. You as well.
Thank you.